When it comes to healthcare transparency, Michigan has earned a failing grade. Hello and thanks for joining us. I'm Laurel Hess and this is Comcast Newsmakers coming to you from the State Capitol building in downtown Lansing. Joining me now is State Senator Jim Marleau, a Republican from the 12th District, which represents a portion of Oakland County. Thank you so much for joining us today.
Good morning, Laurel, and it's a pleasure to be here.
So who gave us an F grade and why when it comes to healthcare transparency?
Well, number one is we have very little transparency, and when you need transparency, the problem is that sharing the information, we do not have a state database, and that's what my bill 333 is all about. It's setting up a database that the insurance companies would report what the costs are, and one of the things that I like to use as a correlation, I don't go to a restaurant, fast food or sit down, and order something and not know what I'm paying for it. But as patients, we all go to the hospital and we're sort of clueless.
Well, for so long, insurance companies footed the bill and our employers footed most of the premiums, and so consumers didn't feel like it was a lot of out-of-pocket to them, and so it didn't matter much. But now more and more of us are paying higher and higher premiums, higher and higher deductibles, and so what you're saying is there should be somewhere we can go to see A, where we're going to get the highest quality care, and B, where we might get the most affordable care?
Well, price and quality is what this bill is all about, and the patient needs to know it. A little side story that brought this to my attention, I had a neighbor, went to his business, I says, you know, you're no longer limping. And he says, no, but I should be because I just got the bill from my hip transplant and I went to the wrong hospital. And I said, what do you mean? And he says, it cost me several $1,000s more than what I anticipated out of pocket. And so that's what got me on this finding out why we don't have that information.
Well, so what exactly does your bill propose? That there would be some statewide consumer database that all of us could access?
The state of Michigan would have the database, community health, and we would just be able to go there and check out the different services. Hips and knees are very popular right now and very expensive. This would not be an emergency. This would be elective surgery that you would check out.
Could this potentially drive the overall cost of healthcare down as hospitals, primary care physicians become more competitive?
I'm a former retail all my life, had my own business, worked for several of the big chains, and competition is definitely in the retail world, and I think that it would serve us well in the healthcare area by having this competition, knowing the costs and so on.
How do we fund, or where does the money come from for the website, and how do we make sure it's going to work? Because we all know that there is a healthcare website out there right now that is perhaps not performing up to its potential.
Well, it's amazing that you asked that, okay? And I have located a grant. It's all we have to do is come up with 10%, and 90% is coming from Washington to help us set up this database. So in my district, the number one thing that I'm hearing from my constituents and all of this newness in healthcare that's churning, that started in 2014, the number one thing I'm hearing about is the increased cost for deductibles and copays. And so this feeds right into it, that lets them see what their costs will be. And I think it's very, very important that we have an informed patient. And one of the things that I like to tell patients is that, you know, when I talk to doctors and nurses and things of that organizations, I constantly remind them that the most important person on the team is the patient.
Is the patient. Thank you so much for joining us today. We could talk about this all day.
We can.
Great bill. Thank you.
Thank you. Appreciate all your help.
Today's Comcast Newsmaker was State Senator Jim Marleau.